these quite difficult circumstances, and in countries where it's not easy to have a good year. That's for sure. Now, Collince, welcome to the presentations. I did introduce you in your absence, so people know who you are, and you're very welcome.
Thank you.
If you'd like to give us your 8 minutes of presentation now, that would be great. Caitlin will let you know when you have done 5 minutes so that you can keep to time, okay?
Thank you so much. I'll try my best.
I'm sure you will. Thank you.
Okay. Thank you so much, Chris, for the invitation for this noble dialogue and conversation. I'll just go straight without wasting my time because I know many have known who I am. So being a young person who is enthused about mental health, and through this, we founded an organization by name Youth and Initiative Development Program, which is based in Kenya. So we are directly involved with young people in disadvantaged community, and we operate in rural community and in Eastlands, part of Nairobi, that is in Jiru. And we use the power of sports to do so. And also as an organization, we want to bring in the center of excellence when it comes to knowledge sharing, and also when it comes to getting the youth to be involved in echoing some of the challenges that they are that they are affecting them mentally. And in my survey, I shared a number of good work that we have done. We've been engaged in convening different stakeholders together and having a dialogue and some of the factors that are affecting the youth mentally, and how private public sectors can work together to generate opportunities for the youth. Because you'll bear me witness, some of the key factors of or the key things that are contributing to mental illness among the youth is lack of opportunity. And we are using this as the power of sport and the power of convention to bring people together so that we may be able to know whatever we are talking about, is it adding up? Do we have mental health scenarios in our communities, or it's just a story? And as it is, we have a lot of mental health, but now the main question, what is a lot? Can you quantify a lot? So that brings us in the need of having the data in our community. And we as an organization now, it's coming up with the best strategies to create an awareness and bring different stakeholders on board so that we can have this data on board. And as an organization also, we are planning for the next year to convene a mental health run, which may help creating awareness to mental health scenarios that we have in the country, and also help the vulnerable youth from the rural communities to be able to know exactly where they can get these services and the need of opening up should they experience some mental health challenges. And these are echoing. Maybe if you are interested, you can also reach out to us so that we can help bridge this gap that we experience in mental health unit in our nation. So some of the learning points that I would like to bring out is the need for data in our community and also in mental health setup. This is really affecting us, and in terms of even for funds allocation in our country, because how will the government allocate necessary funds maybe to eradicate these challenges of mental health that we have in our community? So if it is quantifiable now, the government can be at par, and maybe the relevant institution which are funding these mental health scenarios that we have in our community, to know how much they can allocate to different stakeholders or initiatives which are involved in eradicating and creating awareness on mental health. And another thing which is also coming out, and it's our learning point, is the involvement of religious institutions, having interreligious dialogue, because we all know the very first place that a young person will step on, being a Christian, I'll confidently say this, is churches. When a young person is disturbed mentally, they'll come to or go to churches. And are the pastors who are in these churches knowledgeable on mental health? Can they identify, or sometimes, pastors can be so much trying to pray for this particular person, and yet this is a mental health problem that needs quick intervention from relevant professional bodies or professional persons. So we really need to have a conversation at all levels, because mental health is cutting across all sector. So no sector can be should be left behind, and different stakeholders across board and within our countries can come up together, build synergies and partnership that will ensure that no youth in the community is left behind, and they know the relevant institutions that they can visit so that they can get help. Thank you, Chris. I believe I've managed my time. I was just trying to summarize, but I really have a lot to share, but maybe I'll get time in the next dialogue. Thank you.
Absolutely, and you'll certainly get time in the next year with us, because you're going to join some of our other webinars, I'm sure. Thank you very much indeed, Collince, and I think all of us are touched by the passion and commitment that you show as a young man. It's absolutely incredible to see that. And according to Caitlin, who has just messaged me on the chat here, she says that you did it 5 minutes on the dot. So there you are.